My name is Shauna Newman, and I'm a registered respiratory therapist. When I was working in Saudi Arabia before, I worked at King Faisal Specialist Hospital and Research Center, and that was located in Riyadh, which is the capital city in Saudi. The reason I went over initially was to pay off my student loan. That was paid off in like 5 or 6 months. And then after, this is what happens. Your debt starts like this, your money starts like this, and this is what happens. Your money just goes like this, and your debt is gone. And so after a year and a half of being over there, I put down a nice deposit on a condo here in Toronto. And so I have a lot of equity in my house over here, and I still had quite a decent amount of money when I came back. My decision to return to the hospital was based on a few different things. One of them being I really want to go traveling again, and you have 2 months approximately of paid holidays, so that was one of the reasons. Another reason I wanted to go back is for the money. It's tax-free, so you end up making quite a lot of cash over there. And for the experience, the job itself was pretty good. So working at King Faisal Hospital was different at first because there's the culture shock of being in a new country, but the work itself, there's a big range of the things that we did. So we work anywhere from working with newborn babies to people at the end of their life. And there's 6 different ICUs, 5 or 6 different ICUs there. So you really are seeing everything, and you develop really good skills over there because you have to be able to work in all these different ICUs, which is great. It's good for your skill set as a respiratory therapist. So we do anything from intubating, extubating, running blood gases, go to deliveries. We're at the bedside if we're cracking chests or putting in bedside ECMO up in the cardiac surgery unit, doing breathing treatments, chest physiotherapy. It's really quite a wide range of things that we do as a therapist. When describing the level of acuity in patients compared to Saudi Arabia versus North America, Saudi Arabia, King Faisal is a busy hospital. You see some pretty intense stuff. I was core in a cardiac surgery ICU, so we got all the post-op patients, and it's hustling and bustling. It's busy. You're kind of on your toes all the time. You have to be very good with time management. But also at the same time, there's units that can be a little quieter. Like there's some chronic patients and things like that. But since you rotate through the hospital, you don't know what your day is going to be like. It could be really, really busy, or just like in any hospital here, you could have slower days. But the acuity, I would say, is generally pretty high. The level of autonomy that I had over there was pretty similar to what I have here. However, I know hospitals are all different, like the roles of the therapist are all different depending on where you work. But over in Saudi Arabia, you did have pretty free range. However, they don't just let you run wild. You have to prove yourself. You're new, so you have to make sure you know what you're talking about and back up what you have to say. But as soon as the doctors feel that they can trust you, then often you're pretty much allowed to manage the patient as you see fit, obviously with communicating with the other disciplines of the hospital. But yeah, the autonomy was pretty good. We have a pretty good role over there. Some of the challenges working with different cultures would be the language barrier. So that was definitely a challenge at first because we're often used to speaking to our patients, calming them down, telling them what we're doing. So what I did, Arabic is a tough language to learn, but what you do, you make do with what you have. So you learn kind of the vital sentences and certain words to try to communicate the best you can. Also, when you're in an ICU or in one of the units, the unit clerk, or there's always someone that you can use as a translator. So if you have something really important that you need to get across, you can bring them in with you and you can communicate to the patient that way. But as you start working, you learn to pick up certain phrases that are going to help you in your job. My coworkers came from all over the world. I had people I worked with from Canada, America, Australia, there's other Saudis, there's some Middle Eastern countries that also work there. So there is Lebanese, Syrian, a lot of Jordanians, there's people from Pakistan, people from India, people from Sri Lanka, lots of people from the Philippines, lots of people from South Africa. To work with people from all over the world was actually quite lovely. We all are kind of in the same situation. We're all going to this different country for sometimes the first time, sometimes the second time, and sometimes you feel a little bit lost when you're an outsider coming in. But because we've all been through the same experience, there is a pretty decent sense of community over there. So everyone bands together pretty quickly, and it's a nice feeling. And it's great to learn about other cultures and different nationalities. So I really enjoyed it. The orientation at the King Faisal Specialist Hospital was really good in preparing me for the work ahead of me. Initially, you're down in the respiratory department doing paperwork, taking you through to get all your appropriate, identifications, your AGAMA, which is your resident card, getting you set up with social club, things like that. And then after all of that sorted out, you have orientation through all the different ICUs, and you're in the ICUs. I think it's either a week or 2 weeks of like hands-on, full-on in the ICUs with somebody before they send you off on your own. So yeah, they're pretty thorough in helping you out before they actually send you off on your own. As a Western woman working in Saudi Arabia, I found it to be very similar to what it's like to work over here in North America. It's a team atmosphere. Hospitals are that way. So you're working side by side with physicians and nurses and different disciplines of the hospital, and absolutely similar to what it's like working in North America. So yes, Saudi Arabia may seem intimidating or scary initially, but it was a great opportunity. I'm grateful that I had the opportunity, and that's why I'm going back, because I'm not done. I want to explore a little bit more and learn a little bit more about the culture and just about traveling and life, and it was a great experience. I would highly recommend it.